hope that answered your question. We're going to go to the line now with Dr. Jeff McCombs, longtime friend of mine. Jeff, how are you?
Good. Nice to talk to you again.
It's good to talk to you as well. And I've known Dr. McCombs for many, many years, and Dr. McCombs has become the world's foremost authority on Candida albicans. Now, if you're suffering with fatigue, bad skin, dandruff, if you have depression, mood swings, gas, bloating, if you have digestion problems, if you have sleep problems, if you have bad breath, body odor, all these things could potentially be caused by Candida. And to explain this and taking your phone calls, Dr. McCombs, am I right or wrong with what I just said, or did I just go completely off?
That's absolutely right, but it's kind of the minor list. You can actually even go into all kinds of inflammation of the heart, blood sugar imbalance such as diabetes, hypoglycemia, asthma, bronchitis. So there are a lot of serious diseases which actually can be linked back to Candida.
So if a person, for example, has almost any disease or symptom, you're saying it could have been caused or linked back to a Candida overgrowth?
Absolutely, and then that would be linked back to, more than likely, antibiotic use.
All right, explain to everybody what a Candida overgrowth is.
Well, Candida albicans is a normal yeast that lives in the digestive system. It's supposed to be there. So in its yeast form, it's natural, and there's no problem. But when you take antibiotics and when you suppress the immune system, it will convert to a pathological organism, which then has the ability to travel throughout the entire body, cause inflammation, destruction of tissue, and set up many types of disease processes.
So when this occurs, what type of symptoms does a person develop?
Well, initially it'd be everything you mentioned. A lot of times it's going to be the digestive imbalance because that's the first area affected is the intestinal tract. So you'll get the gas, you'll get the bloating. After about 4 months of having antibiotics, all of a sudden you have a hard time digesting foods. Everything starts to just sit and ferment in your digestive tract.
Now, hold on a second. You said about 4 months after taking antibiotics. Okay, every human being in America is taking antibiotics.
Pretty much, yeah.
I mean, right? I mean, since we were a kid, we just loaded with antibiotics. Today, I mean, if you're a child, the doctors are giving out antibiotics like candy, and I've seen people, and I cannot believe this, and some of you listening, you fall into this category, shame on you. You get a little sniffle, you run to your MD and demand antibiotics. Am I right? Are you seeing this true, doctor?
It is true, and I mean, the ridiculous thing about this is there's now this huge problem worldwide of antibiotic resistance caused by this overuse of antibiotics. And the medical profession blames the patient for that. And it's the most ridiculous thing, because if you want a reservoir of antibiotic resistance, you go to a hospital where people go through round after round of antibiotics. So it's not the patient's fault. It's just that's what happens when you take antibiotics. You create antibiotic resistance, you create systemic candida, you create a lot of problems in the body that someone can have their entire life from that point on.
So you're saying every single person listening who's taken an antibiotic, how much? 1 pill? 10 pills?
1 pill nowadays. You have to, when antibiotics were first used in 1941, they would give you 40,000 units of penicillin. Today, they'll give you 24 million units of penicillin. It's such a problem that because of that resistance, they've had to keep upping the dosage time after time after time. So one pill will create this problem.
So 1 pill creates a candida imbalance in the system, and it starts spreading throughout the entire body.
Correct. Absolutely. So, and it wipes out so many different types of other bacterial colonies that are supposed to be there.
So you're saying every single person in America who's taken one antibiotic has an imbalance of this Candida yeast?
That's what I'm saying. Yeah. And that's what my research shows me.
And that imbalance is leading to, categorically, some type of health problem.
Correct.
Okay, so what's the cure? Now, first off, before you talk about the cure, why isn't the medical community even accepting that Candida overgrowth is a problem? You're saying it's epidemic. Why isn't the medical community even accepting that there's a problem?
I'm not sure about that. I mean, it's basically a lot of what the medical profession puts out is really word for word what the pharmaceutical industry tells them to say. If you're a medical doctor, you'll turn to your medical society, who turns to the pharmaceutical industry and says, tell us the truth. And they will tell you, no, that's not true. Which is, but there are tens of thousands of research papers. There are researchers who devote their entire lives to studying Candida. And if you read the research, you'll see that it is true.
Now, is this potentially the reason why when somebody has fatigue, mental cloudiness, mood swings, gas, bloating, constipation, skin blotches, rashes, eczema, dandruff, maybe just a problem with the hair, skin, and nails, any type of sleep disorder, and they go to their doctor, and the doctor says, there's nothing wrong with you. Are they not diagnosing the potential problem that you're describing as this Candida overgrowth?
Yes, because they can't see the link. They haven't done the study. They're not really informed on microbiology, bacteria, so they're actually not qualified for preventive medicine, for nutrition, so they don't really know how to approach it. If it's not drugs or surgery, like you were saying earlier, then it's kind of outside their field of expertise. And that's just it. It's just that they're not experts in that area. So
when a person has, and again, every single person who's taken an antibiotic has this Candida yeast overgrowth, and this leads to some type of additional, does it suppress the immune system as well?
Absolutely. That's one of the first effects that antibiotics have in the body is suppression of the immune system. And it kills off the good bacteria. And our good bacteria also produce our natural antibiotic, which keeps everything regulated the way it should be. So you take an antibiotic, you suppress the immune system, you stimulate the growth of Candida, you wipe out the good bacteria. And from that point on, it goes on and on throughout the body.
When we come back, folks, if you want to talk to Dr. McCombs directly, give us a call, 888-99-KEVIN, 888-99-KEVIN. If you have a symptom that hasn't been diagnosed, if you've been told it's all in your head, maybe it isn't. Maybe it's in your gut. Maybe it starts with a Candida yeast overgrowth. We're going to give you the cure.